you have been dealing with neck pain and you also struggle with anxiety, now those two symptoms are not a coincidence. They are actually connected by a single nerve called the vagus nerve. Now that runs directly through your cervical spine, and most people have never been told this connection even exists. In this video, you are going to learn exactly what the vagus nerve is, how alignment of your cervical spine directly influences function, and what low vagal tone means for your health. I will also give you 3 specific things you can do right now to start resetting the tone of your vagus nerve. Stay with me because this is going to change how you think about both neck pain and anxiety. Hi, I'm Dr. Tam Lee. I'm a chiropractor here in San Jose, California. Now, I've seen too many people wait too long to get the right help, or just rely on medications just to get through the day. Now, over time, that pain starts to limit how they move, how they work, and how they live. I created this channel for people dealing with neck pain, back pain, disc injuries, or sciatica who have tried everything and are tired of temporary fixes. And you want to understand what is actually causing your pain. Here, you're going to learn safe, non-surgical, science-based ways to reduce your pain, restore your movement, and get back to doing the things your condition has been holding you back from. Subscribe if you want clear answers, real results, and the confidence to move without constantly worrying about your pain. I post a new video every week. Before we get into the 3 resets, I want to give you the foundational idea that makes everything else in this video make sense. Most people treat neck pain and anxiety as 2 completely separate problems. You visit one provider for neck pain, such as a chiropractor or a physical therapist, and a different provider for the anxiety, like your medical physician or clinical psychologist. And they rarely talk to each other, but what if both of those symptoms are actually being driven by the same structural source in your body? That source is your cervical spine. And the nerve it directly affects is your vagus nerve. When your cervical spine loses its normal alignment, it creates pressure and tension right at the pathway of the vagus nerve. That interference alone lowers what is called vagal tone, which means your body becomes less and less capable of shifting out of a stressful situation and into a state of calm. The anxiety and the experience that you feel in that situation is not a psychological weakness or something you need to just push through. It is actually a physical, neurological, downstream effect of a structural problem in your spine. And this is what I typically see in my practice. Patients come into my office describing, anxiety, poor sleep, racing of the heart. And when I look at their cervical spine x-rays, the structural problems are right there. The 2 things are not separate issues happening in the same person. They are the same issues expressing itself in 2 different ways. Let me show you exactly why. To understand why this connection matters so deeply, let's review some anatomy. Now, the vagus nerve is the longest cranial nerve in your body. It originates at your brainstem and exits your skull through an opening called the jugular foramen. Now, that actually sits at the base of your skull, directly adjacent to your upper cervical spine at the C1 and C2 vertebrae. From there, it travels all the way down through your torso and connects directly to your heart, your lungs, your digestive system, and your immune system. The vagus nerve is the primary communication highway between your brain and your body. Its main job is to activate your parasympathetic nervous system, which is your rest and digest, calm and recover state. When your vagus nerve is functioning the way that it should, your body knows how to move out of stress and return to calm. When it is not functioning well, your body gets stuck in what is called a sympathetic overdrive, which is your fight or flight response. And when that state becomes chronic and ongoing, it produces a very specific set of symptoms that you may already recognize. Low vagal tone is the clinical term for poor vagus nerve function. And here are the symptoms associated with it. First, persistent neck pain and neck tension that never fully goes away, no matter what you try. Second, there's anxiety that arrives, without a clear external reason or trigger. Third, heart palpitations or a racing heart while you are at rest. Fourth, digestive problems like bloating or constipation that seem unrelated to your diet. Fifth, difficulty falling asleep or staying asleep through the night. Sixth, brain fog and difficulty concentrating on simple tasks. Now here is the thing that most people are never told. One of the most overlooked causes of low vagal tone is a structural alignment of your upper cervical spine. When C1 and C2 shift out of their normal position, or you lose that natural curve of your cervical spine, that structural change creates mechanical pressure right near the vagus nerve at the jugular foramen. That pressure impairs the vagal nerve, signaling lower vagal tone. And it can produce every single one of those symptoms we just talked about. That is the mechanism. And now that you understand the mechanism, here are the things you can do to reset all of it. Reset tip number 1, chiropractic spinal adjustments of the cervical spine. Now, the most important and most overlooked vagus nerve reset is specific chiropractic adjustments of the upper cervical spine. When C1, C2, or the surrounding cervical vertebrae are misaligned, there is no exercise, supplement, or breathing technique that corrects that structural problem. The only thing that directly addresses it is a targeted spinal adjustment. A specific chiropractic adjustment helps to restore the proper motion, alignment of the cervical joints, reducing mechanical pressure near the vagus nerve pathway, and it creates the neurological conditions your body needs for parasympathetic activation to occur. In my 20 years of clinical practice, I have seen patients experiencing significant reductions in neck pain and a very noticeable improvement in their overall sense of calm following specific upper cervical adjustments. That is not a placebo effect. That is vagal tone improving because the structural interference has been identified and reduced. This is exactly why cervical spinal assessment, including a full cervical spine x-ray from both the front and the side, is so important and critical when you have neck pain, anxiety, and the presenting symptoms at the same time. The x-ray reveals the structural picture that is a symptom-based assessment alone cannot show. And it is often the missing piece that explains why nothing else has worked. The second reset tip is at-home cervical spinal decompression. Now, this is a technique I teach my patients to use between their in-office visits, and it is one of the most effective daily habits you can build to reduce your mechanical pressure in the cervical spine and actively support vagal tone. Here's how to perform it. Lie flat on your back, place a cervical traction device or maybe a firmly rolled towel under the base of your skull and upper neck. Allow the natural weight of your head to create gentle traction through the upper cervical spine. Keep your entire body relaxed, breathe slowly and deeply, and hold that position for at least 2 to 3 minutes. What this technique does is gently open the joints of your upper cervical spine, reducing compression near the jugular foramen and creating physical conditions where your nervous system needs to shift towards a parasympathetic state. Many of my patients report a noticeable reduction in neck tension and a genuine sense of calm within just the first few minutes of performing this move. If at any point it increases your symptoms, stop the technique and consult your chiropractor before continuing. The third reset tip is diaphragmatic breathing. And before I walk you through the technique, I want to be completely clear about something. Diaphragmatic breathing is not the cure for low vagal tone when the underlying cause is a structural problem in your cervical spine. It is a powerful short-term tool that directly stimulates the vagus nerve through the respiratory pathway, and it gives your nervous system meaningful temporary relief while the structural cause is being properly addressed by a professional. Here's how you perform it correctly. Place one hand flat on your chest, one hand flat on your belly. Breathe in slowly through your nose for a count of 4. And as you do, allow your belly to rise rather than your chest. Hold that breath for a count of 1 or 2. Then breathe out slowly through your mouth for a count of 6. Repeat that cycle for 2 to 3 minutes. The longer you exhale is the most important detail here. Your vagus nerve is most active when it's stimulated during the exhale phase of breathing. The longer the exhale relative to your inhale is one of the fastest known ways to activate your parasympathetic nervous system. Perform this breathing technique immediately after a cervical decompression session for a compounding effect on your vagal tone. Diaphragmatic breathing. Very simple to do, and I'm going to walk you through a few different steps on how to do it. First thing you're going to do, like we just talked about, you're going to put one hand on your chest, one hand on your belly, and what you're going to do is you're going to make sure you're breathing from the belly and not from your chest. So I'm going to show you what not to do. That's chest breathing. What I want you to do is breathe from the stomach. If you notice when you're breathing from the stomach, and you gotta really concentrate on this, and you want to take a deep breath coming from the stomach for about 3 seconds, and then blow it out for 10 seconds. The really important part is the breathing out. You want to breathe out longer than when you're breathing in. That's going to raise your parasympathetics so that your sympathetics aren't firing. You want your parasympathetics firing. That's going to help with your vagal tone. So let me bring all of this together for you. If you have neck pain and anxiety occurring together, start with a chiropractic assessment and a cervical spine x-ray to identify the structural cause that may be driving both. Add at-home cervical spinal decompression to your daily routine as a consistent support tool, and use diaphragmatic breathing as a short-term technique to support your vagus nerve while you're working on correcting the structural problem. These 3 resets work best when they are used together rather than in isolation. The chiropractic adjustment is the foundation that makes the other 2 significantly more effective. Everything else supports and builds on it. If you found this video helpful, give it a like and share it with someone in your life who needs to hear this message. And remember to subscribe if you want clear, safe, science-based ways to relieve your pain, protect your spine, and restore your mobility so that you can get back to living the life that you know you can, not just going through it. Now, one of the most common things that damages a vagus nerve is forward head posture, also known as text neck. If you have forward head posture and you want to learn how to fix that so you can stop compressing your vagus nerve every single day, watch this video next.